Hi there, my name is Emily. I'm a third-year medical student studying in Philadelphia, and today I'm going to go over the basics of borderline personality disorder. In this talk, I will be discussing the symptoms of BPD, how it is diagnosed, the treatment, and resources for finding additional information. But first, I wanted to make the disclaimer that this talk is created by medical students solely for the purpose of patient education. It is not to be used as medical advice and does not replace seeing a doctor. But with that being said, let's get into the talk. For starters, a personality disorder is when a person has a persistent way of thinking and behaving that is different from the cultural norm and can lead to difficulty interacting with other people. BPD in particular is associated with the individual struggling with sense of self and being particularly sensitive to conflict or rejection, with a strong fear of being abandoned by others. Those with BPD often have frequent, sudden changes in mood and can have difficulty controlling emotions. Borderline personality disorder affects between 1.6 to 5.9% of the United States population. That may not sound like a lot, but that translates to about 5 to 19 million people with BPD. Many individuals suffering from this personality disorder have a history of childhood trauma, with up to 70% of patients diagnosed with BPD having experienced emotional, physical, or sexual abuse during their youth. Others may also have experienced neglect or had parents who struggled with substance abuse or severe psychiatric illness. In addition to environmental factors, BPD also has a strong genetic component, with studies showing that first-degree relatives of individuals with BPD are 5 times more likely to also be affected by the personality disorder. Imaging of the brain has also shown that some patients with BPD have changes to certain parts of their brain, notably those involved in processing fear and memory. Therefore, changes in brain structure and function may also play a role in BPD. To be diagnosed with BPD, one must experience 5 out of the 9 recognized symptoms, many of which are represented in the image on the slide. Starting off, one of the symptoms is struggling with one's identity or sense of self. Some may also experience intense mood swings or have unstable relationships accompanied by frequent, extreme changes in views of the other person as being only good or bad. For example, a patient with BPD may alternate between thinking their psychiatrist is the best doctor they've ever met to then thinking that they are impolite and terrible at their job within the same appointment. Other symptoms include frantic actions to avoid being abandoned by someone and being impulsive in at least 2 ways that could lead to harm, such as substance abuse, unsafe sexual practices, or spending excessive amounts of money. Some patients with BPD may also self-harm, threaten suicide, or engage in suicidal behaviors. It's also possible for patients with BPD to have persistent feelings of emptiness or feel intense anger, which they find difficult to control. Finally, people with BPD may sometimes feel paranoid, have dissociative symptoms, meaning they feel detached from their body or their surroundings, or have difficulty remembering certain memories from past experiences. I know that was a lot of information, but essentially, BPD is a pattern of thoughts and behaviors that involve struggling to find one's sense of self, in addition to frequent unstable relationships and impulsive behaviors that affect many aspects of the individual's life. There are currently no medications that are FDA approved to treat BPD. Therefore, the treatment is focused on psychotherapy. I have listed the most commonly used therapies for BPD on the slide, the first of which is dialectical behavioral therapy, or DBT, which has been shown to be the most effective. This therapy involves the patient improving their ability to practice mindfulness, manage their emotions, and reduce impulsive or self-harming behavior. The second is mentalizing-based therapy, MBT, which aids patients in understanding the intentions of other people, allowing them to make fewer extreme assumptions about others. And finally, transference-focused therapy, TFP, involves the patient using the relationship that they have with their therapist to gain insight into their problematic behaviors affecting their interactions with other people. Finally, here is a list of trusted organizations that provide additional information on a broad spectrum of mental illnesses. I have also included links from these sites to their pages discussing borderline personality disorder, which will be linked below in the description box. Thank you for taking the time to listen to this talk. Here are my references and image credits.